As a parent, I understand that the decision to start your child on a medication can be a tough one. These are young, developing brains, and we want to be very thoughtful about how we are influencing them. Over the course of working with hundreds of kids and teens with anxiety and OCD, I've seen medication play an important role in the right circumstances. Our research colleagues are also helping us better understand medication impact on anxiety. For example, the Child and Adolescent Anxiety Multimodal Study, or CAMS for short, compared 4 different groups of treatment: medication and therapy, medication alone, therapy alone, and placebo. While medication alone and therapy alone were both better than placebo, they found the strongest impact in the combination meds plus therapy group. The Pediatric OCD Treatment Study, or POTS, used a similar research design for kids and teens with OCD, and also highlighted the combination treatment as having the strongest outcome. The research is helpful, but it can still be hard to make the individual decision for your child. I'd like to think through the pros and cons of medicating and the pros and cons of not medicating when helping a parent through this decision. For example, what is the potential benefit of medicating? For some kids, the volume of the anxiety can get so high that it's hard to engage in therapy and practice the skills that the therapist is teaching. Medication can help dial down the intensity of the anxiety, which makes it more doable for the child to try new ways of responding to their anxiety. The child brain is malleable, so as the child practices new responses to their emotions, new brain pathways are formed. As these new pathways get solidified, it is reasonable to dial back and taper off the medication. I never talk about medication as being a permanent fixture for a child or teen, but rather as a tool to help the child get to a more workable place. What are some cons of medicating? For some people, it can be hard to find the right medication. What might work well for one child might not work as well for another. So a person can feel like a guinea pig while trying to find out the right medication. Some people might also experience side effects. Though I will say that the most commonly prescribed medications for anxiety, the SSRIs, tend to be pretty well tolerated. But it is important to communicate with your clinician about any concerns you have. And what are the pros of not medicating? Some people worry that if they're taking medication, they are not doing the work. They're giving up control to the medication. They might worry the medication will change their personality or how they think. I try to make it clear with families that I work with that the goal of medication is to dial down the intensity of the emotions, not to take the emotions away or change someone's personality. Even with medication on board, they still need to do hard work in therapy. But if the medication doesn't feel right, that's a good reason to stop it or try something different in collaboration with your clinician who's prescribing. And finally, what are the risks of not medicating? Overwhelming anxiety can cause a child to shut down and miss out on important life experiences. Anxious interpretations that the world is scary and unmanageable get reinforced, thus strengthening the anxiety and lowering resilience. So while it can feel uncomfortable to introduce the brain to a medication, it can also be problematic to allow anxiety to overtake that developing brain.